Welcome to the Profit Trap Podcast, Health Insurance Industry Secrets, for anyone who will ever own or use health insurance in their lifetime. Health Insurance Information Alert, 2019 Health Insurance Prescriptions. Now let's discuss prescription benefit plans. This could very well be the number one benefit that causes premiums to rise in cost and is another abused benefit. There are many ways prescription benefits are provided in policies. There are instant copays that have higher monthly premiums for that instant RX benefit versus a plan with a prescription deductible. There are also plans that have tiered drug benefits that require different copays for different drugs. There are many standalone or discount plans that claim to provide savings but usually fall short. Be aware that many plans have annual limits of the benefits or minimal coverage. Certain plans offer a deductible to meet before any prescriptions are even actually covered. What you want in a real prescription benefit plan is no annual maximum benefit levels or non-covered medications. Some plans offer a generic benefit prior to meeting the deductible and then start covering name brand drugs with a copay. Remember, almost all name brand drugs have a generic equivalent. After the patent expires, the drug will usually have a generic and carry lower copay than name brand drugs and provide the same quality of care. Some retail superstores have stepped up and are offering generics at a low cost per prescription with more than 300 drugs to help control consumer drug costs. Get a copy of those drug lists provided at the store and place it with your medical records that you should have a copy of. There are even stores like Publix that offer some prescriptions for free with a prescription from a doctor. When being prescribed medications, remember to question your physician about any affordable alternative prescriptions that do the same quality job. Many physicians may have agreements with drug companies to prescribe their medications first to try and get them into the marketplace, which usually has a compensatory factor involved for the doctor doing that. Always ask your physician for the most cost-effective drug that will provide you the same quality of care even if the drug has been on the market for years. Remember, the newer the drugs, usually the higher the cost, as the drug company is trying to recover its research and development expenses of creating the drug to make as much profit as possible before the patent expires and a generic replacement becomes available. Never make a decision on prescriptions yourself. Always take the physician's advice, but remember to ask for the most cost-effective prescription that will provide the same quality of care. In summary, a deductible is suggested for premium affordability. Try to obtain generic coverage prior to meeting a deductible. Ask the physician to prescribe you with the name brand drugs after the deductibles are met. Make sure there are no annual maximum limits, no restrictions of any kind, and no uncovered prescriptions in your health plan. This helps give you the best access to quality prescription care, especially if an illness occurs that requires long-term or lifetime medications. Now, whether you are insured or not, always compare drug prices before buying. Through research, I would suggest going to GoodRx.com for a great starting place for prescription savings, whether you are insured or not. Even if your doctor sends a prescription to a pharmacy and you find a better price elsewhere, move the prescription to that pharmacy after you do a cost comparison. Coming March 31st, 2019. Like us, follow us, share us, subscribe to us, and download us. The Profit Trap Podcast, Health Insurance Industry Secrets. You can find us on YouTube, Facebook, Instagram, Twitter, our podcast, and the website. Depending on the media venue you are viewing right now, you may find the links below. Get connected today so you don't miss out on any of this must-have, need-to-know information to protect yourself, your family, your assets, and your future.